Hello everyone, Dr. John Bartemus here with today's functional nugget. A common question I get is, why is my joint pain worse some days and less others? So why is my pain undulating? Why is it not the same every single day? Well, that's a great question, and it's not uncommon for me to get it from an elderly person or from someone that has arthritis or joint degeneration of, say, a knee, a back, a neck, any extremity, elbow, wrist, ankle. So pain, if your pain is undulating or your pain is worse some days and better on others, then there may be an underlying inflammatory component to it. And the way that this works is basically, if you're in a hypoxic situation, meaning you're lacking oxygen, hypoxia, or a lack of oxygen, a relative choking, right, is pro-inflammatory to the body. So a relative hypoxia causes an increase in inflammation produced by the body, and that increased inflammation is going to drive joint pain specific to wherever your arthritic joint changes are. So what causes hypoxia? Well, when barometric pressure changes, especially when it drops, that creates a relative decrease in oxygen in the atmosphere, which is a relative hypoxia to your body, ramping up inflammation and creating pain in your joints during those weather changes. If you travel to altitude, the air's thinner up there, there's less relative oxygen, that drives inflammatory production and increased joint pain. It may also drive, the hypoxia can also drive autoimmune flares, or if you have any sort of inflammatory disease, anything inflammation related, the hypoxia drives further inflammation and drives further symptoms associated with those things. So if you have undulating joint pain or ebbs and flows of flares in your autoimmune disease or inflammatory disease, then hypoxia may be a driver of that. And so we need to think about, what is your oxygenation capacity, what are your iron levels, and what are your overall systemic inflammatory levels.